the chance of COVID taking hold in our communities and spreading like wildfire is so much greater. So, yeah, I'm very worried.
People are scared, people are anxious, and people are calling loud and clear for higher rates of vaccination and higher rates of testing.
Worst case scenario is that this runs wild and we end up seeing a loss of our knowledge and culture through this disease.
For many, the situation unfolding in Western New South Wales is one they've long feared. More than 90 cases of COVID-19 have been confirmed in the region, home to some of the country's most vulnerable First Nations communities.
I can't even contemplate catching COVID, really. I kind of think if that happens in that regard, then I'm dead.
Wiradjuri elder Frank Doolan, better known as Riverbank Frank, hopes to get vaccinated in the coming days. He was hesitant at first, but decided to get the jab to protect his family and community. Now he's teaming up with the local council to ask others to do the same.
I would urge my people, any of you out there, to stay home.
Aboriginal people make up most of the positive cases in Western New South Wales. Almost 40% are children after the virus swept through several Dubbo schools. Health authorities have hastily set up testing and vaccination centres with thousands of vaccines deployed to the region. But some are asking, how did it come to this?
We always knew that our Aboriginal community was going to be especially vulnerable to COVID-19 and especially hard to reach in terms of vaccination. And look, that has certainly turned out to be the case. A lot of criticisms are being made.
Early on, First Nations people were identified as a priority group in the national vaccine rollout.
Indigenous Australians were one of our greatest concerns at the start of this pandemic. So this is a key issue to be addressed in the strategy and the rollout plans.
Yet nationally, less than a third of eligible Indigenous people over 16 have had their first jab, while 15% have had 2 doses, lagging well behind the general population. In Western New South Wales, only around 8% of the Indigenous community is fully vaccinated.
There is very limited information about Aboriginal and Torres Strait Islander vaccinations. To get this information at the moment, it has to be requested. Data is really critical because it lets us know who needs what, where.
3 hours north of Dubbo, some in the small community of Walgett are living in fear.
I'm 59-year-old and I've never ever seen anything like this in my life. All morning we've been going around taking hand sanitizer and masks, dropping them off. They're too frightened to even come out of their front door.
There are 4 confirmed cases in the country town where more than 40% of the population is Aboriginal. Overcrowding is rife due to a housing shortage, and the local hospital has only 4 beds. Local elder Kim Sullivan was vaccinated earlier this month, but worries that many other locals aren't. And while there is hesitancy in the community, she says the federal government could have done more.
They'd have never protected us. It wouldn't be here if they protected us. Simple as that.
In a statement to 7:30, a spokesman for Health Minister Greg Hunt said Indigenous people in remote communities remain a priority in the vaccine rollout. Aboriginal and Torres Strait Islanders aged 12 to 15 are now eligible to be vaccinated. Thousands of extra Pfizer doses have been delivered to Aboriginal health services in regional New South Wales, with a further 1,800 doses provided to GPs in Dubbo today. As a COVID scare sends Darwin and Catherine into lockdown, some of the Territory's Aboriginal communities are better prepared.
Up here in the Northern Territory, we see Aboriginal and Torres Strait Islander community-controlled sector pulling in people and vaccinating and doing a call-out to the community. This is why it is really important to listen to Aboriginal and Torres Strait Islander people as to how to best work this on the ground.
In Western New South Wales, it's hoped a similar response can avoid a worst-case scenario.
We need to, all of us, that is black and white. We need to draw together, and we need to search for solutions in this, but mostly we need to maintain a sense of unity, because COVID isn't black or white.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.